Texas faces a severe shortage of primary care providers, a problem that stretches from our rural areas to our major urban centers. The Texas legislature is currently considering a dramatic plan to address this shortage by providing financial incentives for those willing to serve in medically underserved areas. Healthcare providers, patient advocates, and community leaders from Greater Houston gathered at the Good Neighbor Healthcare Center to lend their support for this historic proposal.
Local healthcare providers and some of their patients are speaking out today about a shortage of doctors in the Houston area. They will ask state legislators to pass a bill that would establish the Texas Healthcare Access Fund. It would help doctors and other healthcare providers pay off student loans, and in return, they would have to make a 4-year commitment to practice in underserved areas. You know, more than half of Texas counties, including many in the Houston area, are struggling with a shortage of doctors.
Houston, it's hard to believe there is a doctor shortage anywhere in Harris County. But healthcare providers say there is a shortage here and that it's much worse in counties all over Texas. Fox 26's Andrea Watkins joins us now live to tell us about some proposed state legislation designed to ease that problem. Good afternoon, Andrea.
Hi, Jose. You know, the director of the Good Neighbor Healthcare Center here in the Heights says right now it takes 2 to 3 months to take on a new patient. And the problem isn't money. It's a shortage of primary care physicians. Now today, this clinic and others in the area got behind proposed state legislation that would create an incentive for medical students to become primary care physicians. It's House Bill 1876, the Texas Healthcare Access Fund. It would be a pool of new tax dollars that would reimburse doctors for medical school costs if they committed to work in underserved areas. Now right now in Texas, 26 counties have no primary care physician, 18 counties have one primary care physician, and 46 counties have no dentist at all.
We all have to go to a primary care physician. If you have insurance or if you don't have insurance, most specialty services require a referral from your primary care provider, but finding a primary care provider that can see you in 2, 3, 4 months can be the difference between life or death.
Now, to pay for this program, the bill proposes to increase taxes on smokeless tobacco by $50 million. It would restructure the way the taxes are collected to collect $1.10 per ounce of the smokeless tobacco, regardless of the type of smokeless tobacco purchased. So currently, according to the state numbers, the taxes on smokeless tobacco raise $90 million. That goes to property tax in the general fund. The new tax system would collect a total of $140 million, an average of 56% tax increase, and all of those new funds collected would go to doctors working in underserved areas. Some may say that is a lot of money, but the proponents of the bill say that having a shortage of doctors creates delayed treatment. This creates higher hospital bills, and it costs lives. Live in the Heights, Andrea Watkins, Fox 26 News.
We're looking for support for House Bill 1876. This will be a way to help our physicians, nurse practitioners, and other healthcare providers get tuition reimbursement if they provide care to those most in need in our medically underserved areas. The whole state of Texas is going to be impacted to the good by passage of this bill.
We want them to contact their legislative, their state reps and their senators to support the bill, because it is important to Harris County FQHCs in particular. We're in the most uninsured county in the nation.
En otras cosas, el sector salud también tiene noticias preocupantes el día de hoy. Varios miembros de la comunidad médica de Texas aseguran que en nuestro estado hay una falta de profesionales de la salud. Mariana Pineda está en el noroeste de Houston para contarnos cuál sería el plan para solucionar este problema.
Así es, Osvaldo. De hecho, contar con un médico de cabecera es clave no solamente porque conocerá mejor su historial médico, sino porque, de acuerdo a las últimas estadísticas del sector salud, cada vez menos médicos familiares quieren practicar en Houston y a lo largo del estado. De acuerdo a estadísticas de la Academia de Médicos de Texas, más de la mitad de los condados en el estado atraviesan una necesidad de médicos familiares.
Es muy difícil atraer a los médicos a la ciudad de Houston, especialmente en las clínicas que son comunitarias, por el salario, porque no tenemos demasiados fondos para pagar lo que un doctor privado en una clínica privada pagaría del salario.
El promedio de un médico familiar se gradúa con una deuda de $160,000, motivo que no atrae elegir zonas rurales. El proyecto de ley 1876 busca indemnizar parte de la deuda al comprometerse con un servicio de 4 años completos. Asimismo, disminuiría la visita a urgencias.
Muchas personas van a la sala de emergencia, pero no es la manera mejor para mantener la salud. Una persona necesita un doctor de cuidado primario.
De acuerdo al Departamento de Salud de Texas, 26 condados no cuentan con médicos familiares y solo 18 tienen un médico general. Jesús Martínez, quien es paciente de una clínica comunitaria desde hace 7 meses, se considera afortunado al contar con dicha práctica.
Es mucha diferencia. Aquí yo acabo de llamar apenas, ¿qué será? A las 10 de la mañana y a tengo la cita a la 1:30 del día para entrar a ver el pediatra. Es mucha diferencia.
De aprobarse el proyecto de ley, los fondos provendrían del impuesto en el tabaco.
Si una persona necesita pagar más para el tabaco, muchas personas van a dejar de usarlo.
De acuerdo a miembros del sector salud, usted puede apoyar a que este proyecto de ley pase únicamente comunicándose con la Casa de Representantes y el Senado del Estado. Desde el centro de Houston, Mariana Pineda, Noticias 45 Univisión, a las 5.
Nosotros queremos saber su opinión y por eso hemos iniciado una encuesta en nuestra página de internet univisionhouston.com. La pregunta es, ¿cómo ha sido su experiencia al recibir atención médica? ¿Buena, regular o mala? Los resultados de este sondeo se los daremos a conocer mañana en Noticias 45 Univisión a las 5 y de antemano, muchísimas gracias por participar.
Experts say something needs to be done to fix a critical shortage of doctors. They used a Heights area clinic to push a bill now in the Texas House that would help establish a healthcare access fund to address the problem. Doctors say the Houston area has been severely impacted by the shortage of physicians, nurse practitioners, and dentists.
It takes Good Neighbor Healthcare Center approximately 2 to 3 months to take on a new patient. Not that we don't want to see the patients, but our physician schedules get full. And while we try to serve as many as possible, there is really a limit to the number of people that any medical provider can take in a day's time and still provide quality care.
Officials say the biggest challenge is recruiting healthcare workers to work in poor and rural neighborhoods.
She's pleased to represent HB 1876 to support bringing more primary care physicians into the state and incenting those medical students to really look at this field as a representative for the Texas Medical Center. She sees this as a critical need, both in the urban core as well as the rural areas in Texas. And so this bill is a wonderful opportunity to bring more people into this particular field and really serve the needs of our state and our residents.
We're here to just say that the city supports this bill, HB 1876, and any bill that will promote increasing primary care providers in our Houston clinics. We know there's a shortfall, and we're here to say that we support any bill that will do this.